learning programs, we are going to have the following as interventions. We have just classified them now per province, per area, and per race and per gender. So this is all in totality. That is the 2003, and the learning programs for 18.2 will be 3,838. The internship programs, as we can see there, we have just we took the same data and then tried to populate it in a graph form for financial year 2021 to 2022. The same applies to the bursaries for employed. It's going to be with that in terms of employed learners under new registrations, and that will have a total of 215. And then the employed learners that are continuing is going to be 92. And then the bursary programs for new learners, that is those that are doing doctorates, will be 6. Those that are doing masters are 32. Those that are having certificate programs are 12. Those that are doing BSc programs are 60. And those that are doing diploma are 84. And bursary programs that are continuing, that means that have been in existence, that are continuation, we have 12 for PhD. We have, for masters, we have 18. For BSc and other undergraduate, we have 40. And for diplomas, we have 19. The bursaries for bursary programs for unemployed, we have as follows. For the unemployed learners and that are new registrations, they are there classified as per province. And Limpopo is having 102. We have Gauteng with 64, Mpumalanga with 29, KZN with 103, and then we have Eastern Cape with 109. We have Western Cape with 64, Northwest with 49, Northern Cape with 5, and Free State with 17. These are for the unemployed. So those that are continuing with our bursary programs are 77 for Limpopo. We have 34 for GP. We have 19 for Mpumalanga. We have 86 for KZN. We have 10 for Eastern Cape. We have 46 for Western Cape. We have 18 for Northwest, and then we have 0 for Northern Cape. And Free State, we have only 5. The bursaries for the bursary programs for the new registrations for the unemployed, for PhD, we have 5. Those that are doing masters is 69. Those that are doing BSc and other B degrees are 84. For diplomas is 387. The bursaries that are continuing is for PhD we have 3. For master's degree we have 48. For BSc we have 44, and for diploma we have 199. AGRISETA's performance journey. AGRISETA in performance, the actual performance is in 2016-17 was 76. In 2017-18 was 62. In 2018-19 was 54. In 2019-20 was 86. In 2021 it was 73. And then the unaudited organization, the currently unaudited performance is at 93% for this financial year. Now we look into continuous improvement. Our role, our aim is to end up having a clean audit. And now we look into which areas that we need to have more visibility and improvement on. We are focusing mostly on to have a clean audit. We are currently strengthening monitoring and evaluations of our programs. We are improving stakeholder management. We are broadening partnership and synergies. We are striving for high performance, and that is the approach that we are currently implementing as a SETA to can achieve. The implementation of master plan. We have different master plans from different agricultural organizations. The poultry master plan is everything now depends on the implementation, and then we have the intervention role, we have value chain approach and sustainability, we have funding of clusters, agriculture and agro-processing master plan, and sugarcane value chain master plan for 2030. These are the master plans that we have within our institutions and that we are currently working together with those organizations. AGRISETA Job Seeker Employer Mesh Making App. AGRISETA has an app that meshes the employer and the job seeker. So what the work seeker, that is what we do is they place their information under the portal, and we are able to can and the employer is able to can go into our portal and be able to can identify through the CVs of people who need the job in terms of agriculture. Our aim is basically to contribute to the goals of NDP and to create 1 million decent jobs by 2030. By December 2022, our app managed to connect 3,000 beneficiaries with employers. The implementation of HWSETA's role to link the learners directly to the employer in agricultural industry, we are trying to do, we can say we are fairly doing very well in terms of that space. As to be known, to be visible, we have career guidance collaborations with different HWSETAs. These are basically this is just to mention a few of the HWSETAs that we have collaboration on in terms of our career guidance. In terms of we go to schools to make learners to understand what the HWSETAs offer and to make them awareness, to make HWSETA awareness to all of our learners throughout the country, not to a specific area. We look into organizational risks. We have the board, and the board is being objective. The objective of the board is tasked to governance and to do oversight. And the chairperson, that is me, being appointed by the minister, and then we have frequency and quarterly meetings with the minister. And then with EXCO, we have also EXCO, and then our EXCO is also having their own quarterly meetings internally, and we are meeting as we are supposed to. And then we have both subcommittees. This is just to show what we're trying to work on as a HWSETA, as a board, and just to give to honorable members exactly what the AGRISETA is having as a structure from our side. And we have subcommittees that sits, and then that have most of the time we have meetings that ensures that everything that is within the institution is done in an orderly and in a correct format. And then we have audit and risk committee, which is an independent review of organizational performance and management of risk exposure. This is 100% independent. And then we have the risk management committee and ICT steering committee within this audit committee. This is just to show the organizational, the strengthening of controls within the institution. With that being said, I would like to thank the institution for being responsive to what our honorable members has requested, and I'm handing over to you, Chair, and thank you for the opportunity to present to you. Thank you so much.
Thank you very much, Chairperson of the HWSETA, of the board. Earlier, we would have liked you to introduce the entire team, just to acknowledge and note who is with you, Chairperson board.
Oh, okay.
Today,
okay, thank you, Chair. Today I am with our CEO, Dr. Shirova, and then we are with our CFO, the Chief Financial Officer, our CFO, Ms. Sibela, and then we are with Executive Manager Skills Planning and Research, Mr. Foshe, and then we are with our Executive Manager Planning and Programs and Project, Mr. Shabangu. We are with our Corporate Executive Manager, Dr. Lezwalo. We are with our Company Secretary, Mr. Mzwanda Langa. Thank you so much, Chair.
thank you very much, ma'am. The importance of doing this is when members
I think Honorable Mahlati's network has went off. We'll try and alert her now. But in the meantime, can we also have a presentation from the Health and Welfare HWSETA? I'm not sure if the chair of the board there will do the presentation, or they will just give us an opening remarks and give to the CEO, because we saw that AGRISETA, the chair of the board, did the presentation. So I'm not sure how at the health and welfare sector are going to do. I'm assuming, Memnis, you are the chair of the board and you was going to do the opening remarks and then give to your CEO. Thanks. Come through.
Thank you, Chair. I really appreciate this opportunity, and as the health and welfare sector, we appreciate the opportunity to come here and present to you, showcase what we are doing. I would like to indicate that we are here. I'm with my CEO, and the other executive CFO is also here, Ms. Zandi Mafata, and we acknowledge this opportunity. And I would like to indicate, Chair, that we are presenting to you here, having, during the space of audit, as we all are aware, and we are proud to say for the past, for a very long time, let me talk for the term that we've been in ourselves. For the past 3 years, we've managed, to keep a clean audit, and we appreciate the effort that we receive and the support that we receive from the department. We are the health and welfare sector, and that makes us to work with all other sectors, with all other sectors. If you look at it, every sector, every citizen needs health and everyone needs welfare. So that makes us to cut across. My colleague here who just presented the AGRISETA. We work with them, all other sectors, because we are concerned with the health and the welfare in the training space. When COVID came in 2020, and most of the other organizations had to shut down, we're the ones who had to go in front and say, we are here. We will provide all the training opportunities so that the citizens and the working force can be equipped. So we are proud, Chair, to indicate that we are the sector that you can trust, and when everybody else moves away, we are the firefighters. We go in front. And I would like now to introduce our CEO, Mrs. Elaine Brass, who will do the presentation for the HWSETA. I thank you.
Thank you very much, Chairman of the HWSETA Board. And I would like to greet the esteemed members of the Portfolio Committee, the members from the Department of Higher Education and Training, the Director General of the Department of Higher Education and Training, and our colleagues from the Agricultural SETA, as well as the colleagues from HWSETA. As our chairperson has indicated, we are absolutely honored to be with you this morning to present what we are and what we have done over a period of time, and also specifically to focus a bit on nursing. I'm sure it is an area that you are quite interested in. I am going to now just stop my video and then share my screen. Chair, I hope that you can see the presentation on the screen.
Yes.
Thank you very much. The Health and Welfare Sector Education and Training Authority has a vision to create a skilled workforce for the health and social development needs of all South Africans. And our mission statement, Chair, is the HWSETA endeavours to create an integrated approach to the development and provision of appropriately skilled health and social development workers to render quality services comparable to world-class standards. And Chair, just to also mention, we take care of the health and social development sectors as well as the veterinary sector. I'm now actually thinking of agriculture, Chair, but the veterinary science sector as well. We do have values. We've got these 7 values that we hold dear to us, and we ensure that in everything that we do, we have these values that direct us in our daily operations. We wanted to show you what the labour market profile looks like in our sectors of health and social development and veterinary science. So over a period of time, you'll actually see the public and private sector, the split. So initially, you would see that the public sector, the number of employees employed in that sector was higher than the private sector. But over a period of time, and you'll then see in the year 2020, that in fact, we have more in the private sector compared to the public sector. We have a total of roughly 789,000 employees in the sector of health and social development. In terms of the occupational groups and distribution of total employment, most of our sector is made up of professionals and professionals over the private and public sectors. Then the next highest cohort of this particular labour market is technicians and associated professions, then clerical support workers and so forth, Chair. But you'll actually see the highest percentage in the professional area. The public and private sector, there is also the distribution of the provincial service in the public and private. And you'll actually see that the public service has a greater service in the other provinces compared to the private sector. The private sector services largely Gauteng province and KZN province. The population group distribution of total employment, most of the employees in our sector are African employees, then followed by white employees, coloured, and then Indian. In terms of the distribution, you'll see that on the right-hand side of the screen, and the make-up of those particular groups across the various occupations in the sector. So in terms of our professionals that I pointed out in the previous slide, most of our professionals are in fact African professionals. And then also in terms of managers, they also make up most of them, as well as technicians and associated professionals. We have skills, key skills change drivers that we have identified in the health and social development sectors. And you'll actually see that over a period of time, there is a great demand for social and healthcare services. And the reason for this is the high burden of disease in our country, our challenging social and economic realities, changes to the scope of practice of professions, as was demonstrated by the Department of Higher Education and Training this morning. We do have the ERRP and ERRP skills strategy that is also driving our strategy and funding. The National Health Insurance and re-engineering and expansion of primary health care is a key driver. High levels of interpersonal violence, and of course technology, sorry, I'm not pronouncing that properly. Technology changes is also a key driver, especially in the health sector. Occupational shortages and skills gaps. Through the comprehensive research that we do as an HWSETA, we have identified hard-to-fill vacancies. And of the last research and our sector skills plan, this is the makeup of the hard-to-fill vacancies. So mainly in the professional level, mainly in the private sector, then under technicians and associate professionals, mainly in the private sector, then followed by the public sector. So once again, our need is at the professional level and technician and associate professional level. So here is just another indication of the nature of our skills needs. Mainly high-level skills that is needed in our sector of health and social development, and that is also the makeup of the private and public. The main reasons and areas of focus, there are two graphs there. So the reasons for hard-to-fill vacancies, the main reason is scarcity of people with the required qualifications. Followed by lack of experience, scarcity in the area or geographical location plays an important role. Unfortunately, resignations due to COVID-19 has also affected our sector. And then in terms of what are the main areas of hard-to-fill vacancies, nursing professionals. And that is also, we have also presented a couple of slides today around nursing in particular. Then we've got specialist medical practitioners, personal care workers in health, pharmacists, and medical imaging and therapeutic services. So that is the makeup of the needs in the health and social development sectors. Also here, we have now identified in terms of the hard-to-fill vacancies. Right at the top is the enrolled nurse. So that is the #1 need in our sector through the research that we have done. The registered nurse is also greatly in demand, followed by other nursing staff and medical and clinical staff. Public versus the private sector. In the public sector, on the left-hand side of the page is registered nurses that are needed, surgical registered nurses, then registered nurses in the area of mental health, and then of course, forensic pathologists. In the private sector, it's a little bit different. We do need enrolled nurses. That is right at the top. Retail pharmacists, social counseling workers, first aid attendants, and then community development managers, training and development professionals, and then other support staff. So that is the difference between the public and private sector needs. This page is also quite interesting and will show you the makeup of our sector between health, social, and the veterinary sector. So most of our sector is made up of the health sector. It forms a large part of both the levies that we receive. However, in terms of the funding that we give into the sector, we ensure a good spread between the health sector, social development sector, and veterinary sector. But one can actually see that the health sector is very large, and the smallest sector is the veterinary sector. The first top 10 occupations in high demand has been identified by the HWSETA through the research that we have done. Once again, the nursing professionals come up tops in terms of occupations in high demand, and then it is followed by other medical staff occupations. If you have a look further down the page, we've also got the social counselling worker, the adoption social worker, and the veterinarian. Then, Chair, in terms of the analysis of the performance of the HWSETA over a period of time, in fact, we have just finished and closed off the year 2021-2022, so the performance is not depicted on this particular slide, but you'll actually see in terms of the performance against our targets, we have had really good performance over a period of time. In the year 2021, we were severely affected by COVID-19 for various reasons, but we have now picked this up extremely well and significantly in the 21-22 year, where we are sitting on an unaudited figure of 90% of performance. For the last 14 years, we have attained an unqualified audit, and we also expect an unqualified audit in the year 21-22. Chair, we just wanted to show the committee our commitment to youth unemployment and our contribution towards that. We have at least 10 indicators that will support unemployed youth. These are some of the indicators that is shown in our annual performance plan, and this is year on year. So we support unemployed workers in terms of undergraduate bursaries at various universities across the country. TVET bursaries, we put in a tremendous amount of funding in terms of that. Postgraduate bursaries, we fund artisans and technicians. Learnerships. Learnerships are one of our funding areas that we put the most amount of funding towards. On average, in terms of these indicators, 60% of the funding that goes towards these indicators is to support the youth. Further indicators are AET programs, skills programs, internship programs, TVET, work integrated learning, and university work integrated learning programs. In the year 2021, a total of 75% of the total unemployed funding went to youth. The total budget spend for unemployed funding was 238 million rand. Youth unemployment and our further contribution is, as I have mentioned, at least 10 interventions have focused on youth, and this is a hybrid of workplace-based programs, academic programs, and short learning programs, as I have displayed. TVET placements, very important for us, and is a focus. So you'll see in the year 2021, which was last financial year, and the financial year that we have just finished, that in the 21-22 financial year, we increased that support to 94 million rand. 79.8 million rand went to TVET, work integrated learning. The Presidential Youth Employment Stimulus Program is what the HWSETA has also committed to. And if you have a look at the last financial year, which is 21-22, you'll see once again the TVET work integrated learning support of almost 80 million rand, internships TVET graduate support of 14.5 million rand, and artisan support of roughly around 100 artisans a year, costing around 20 million rand. In total, 114 million rand towards this commitment. Targets for our next financial year, 22-23, we are supporting largely TVET work integrated learning for learners that enter that, learnerships in terms of employed and unemployed, and internships TVET colleges and university graduates, a support there, and artisans. In total, 227 million rand will be put aside for the 22-23 financial year, supporting 6,265. Our community-based projects. Since 2020, the HWSETA has trained 329 officials from NGOs and CBOs operating in the sector on social entrepreneurship across all our provinces, and again, across all our provinces, ethics and governance. We actually found that this was quite useful for NGOs and CBOs, and has actually been quite impactful. So in particular, we looked at the provisions of the MPO Act and King 4 report on good governance. Then the HWSETA also partnered with CBOs in the Northern Cape, Limpopo, Mpumalanga, Eastern Cape, KZN, Western Cape, Northwest, and Free State. You would think that that is all 9 provinces, but not quite. And we partnered with them to identify and recruit learners from indigent families in poverty nodal zones. In particular, learners were placed in high-demand learnerships and apprenticeships with guaranteed employment. To this end, 250 learners have benefited from programs such as laboratory technicians, phlebotomy techniques, millwright trade, diesel mechanics, and boiler makers. Amongst the areas touched by this initiative were the ones mentioned there on the slide. 80 learners, Chair, have already graduated on the millwrights and are in the workplace, while 70 are due for trade tests in June and July this year. 40 learners will be writing final examinations for laboratory technicians, phlebotomy technicians in October. And in fact, the phlebotomy techniques program has been highly successful. Most of the learners that undergo this particular training is offered immediate employment. Some of our government programs, we have a specific target for this, an indicator for this, and it includes the NHI governance in health districts, healthcare quality and patient safety, COVID-19 for emergency medical services staff, matric upgrades for departmental staff to access programs such as pharmacy assistance and emergency medical services, anti-gender-based violence and femicide, anti-bullying program in schools, placement of social workers and social auxiliary workers in schools, as well as child and youth care workers. And this program in particular has actually been quite successful and not yet completed. The above programs are implemented through partnerships with NGOs, universities, and public colleges. And we have found that through our partnerships, we have had great impact in our sector over the last couple of years. For the year 22-23, a program for hospital boards and CEOs will be initiated. Here is also just a depiction of programs for workers and unemployed workers in the year 2021 and 21-22. You'll actually wonder why a bit more for the year 2021 under programs for workers, but this was in particular in response to COVID-19 and especially on skills programs to address the specific needs in demand over the pandemic. We are committed to the ERRP, Chair, and we've got various interventions in place to demonstrate our commitments over the our commitment is not only in terms of our last financial year, it actually culminates or actually runs through our strategic plans in the MTEF period. So there are our commitments to the ERRP, And in particular, Chair, in terms of progress and what are we in particular supporting through the ERRP, we are finalizing engagements on service level agreements with the QCTO. Through this particular SLA, the HWSETA will promote access through accreditation of skills programs. There's been an application for updating the medical equipment and maintenance qualification. This has been submitted to the QCTO. And we're also looking at starting scoping the qualification for optical technician and visual screening. The research agenda for this next financial year includes a research topic on the role that can be played by the HWSETA on the indigenization of manufacturing of medicines, medical devices, including optical devices. The HWSETA has funded 795 early childhood development learners through learnerships and vocational bursaries over the last financial year and will continue to support the training of these practitioners. The HWSETA has also funded 100 artisans and will fund 140 artisans in the next financial year. We also are supporting entrepreneurship and innovation. So a concept paper on supporting social service practitioners to become social entrepreneurs has been developed. Engagement between the HWSETA and universities have commenced with the aim of entering into partnerships to train unemployed social service practitioners. And Chair, this is actually going to be quite a breakthrough in our sector of social development. One of the major challenges is the uptake of employment in this particular sector. So the HWSETA looking at social entrepreneurship will certainly go a long way in ensuring that practitioners in this particular sector can also earn a living. National Pathway Management Network, the HWSETA has been nominated to form part of the steering committees for ECD and health through the ERRP, PYEI's work stream. So we're part of those committees and are active. In our APP of 22-23, we have made some changes to this APP. We've looked at the indicator for internships to be disaggregated to have targets for university and TVET college graduates. We looked at that ratio. Public-private partnerships to promote social entrepreneurship, as I've mentioned, and digital literacy to be promoted as a cross-cutting intervention. So we are looking at curriculum to have digital literacy as one of the fundamental subjects and top-up skills for those who qualify on digital literacy. Chair, just to also give you an indication of our performance over the last couple of years. While we have areas of excellence, we also have areas that we need to continue improvement in. And Chair, we do strive to improve our service delivery and our governance on a yearly basis. Specifically, Chair, skills development programs in the nursing sector, the HWSETA in its strategic plans and APP plans have made provisions to support nursing and agricultural colleges. These plans are within the support given to the college sector in line with the National Skills Development Plan, the National Development Plan, and the White Paper on Post-School Education and Training. Chair, in pursuance of these plans and targets, the HWSETA has approved budget and set targets to achieve and support this particular sector. There have been challenges affecting nursing capacity. The transformation of the nursing qualifications framework has had significant negative impact on the supply of nurses due to training of nurses having to take place at a higher education platform. These change predates the COVID-19 pandemic, and this was also communicated by the Department of Higher Education this morning. Lead times required to train health professionals both as graduates and meeting requirements for practice. It takes 3 to 4 years to ensure that a health professional can graduate, and sometimes, depending on the specialities, even more. Shifts from the National Health Insurance Policy through the re-engineering and expansion of access to primary health care, which increases the demand of healthcare professionals. So this has also been a challenge. High burden of disease experienced in our country, as I have pointed out earlier in the presentation, gender-based violence, all has an impact on the demand for nursing capacity. COVID-19 pandemic, of course, has exacerbated the existing challenges in our health sector. So the supply of nurses, to an extent that additional budget had to be approved by Treasury, and calling of